Hello, this is Dr. Guidry. Welcome to another episode of season 4 of Dr. G at the Heart of Healthcare. I am here with an expert from Parkinson Voice Project, Hilary Byatt. Welcome to the
Hello.
show.
Thank you, Dr. G. I'm so excited to be here. Thank you for inviting me.
I'm so excited to be your student. I'm like a teacher's pet already. Yeah. So thank you for being here. Audience, let me just tell you real quick. I learned from Hilary when I was at the National ALCA conference, and she did a wonderful presentation. We'll get to that in the story, but that's why we're here. We're here. We want to learn about speech therapy because this is something that's underutilized. As a physician, I've written orders for it, but I don't know about the magic that happens. But Hilary, she showed us during that presentation. So before we jump in, why don't you tell us like a 30-second bio about yourself so people can know who we're learning from today?
Oh, I'd be happy to. Thank you. I was born and raised in Houston, Texas. I got to Dallas for my bachelor's. I went to SMU in Dallas, and then I got my master's degree from University of Texas at Dallas up here in speech pathology. So I have been in the Dallas area ever since. I am happily married for many years, and I have 2 grown children. And an exciting thing is that both of them got married last year. So that was a fun, busy year, and we just celebrated my daughter and son-in-law's first anniversary.
Okay, I love that because I'm about to be a mother of the groom in June in Dallas. So you
Oh
got to
my
give me some
goodness.
tips. You got
Oh
to give me
yes.
some tips on getting the good dress.
Well, yes, absolutely. And I underestimated how wonderful it was when your kids find their person.
Mm,
It's magical. So
it
I'm so
is.
excited for y'all.
Yeah, yeah. Isn't that funny? I didn't put that together. We'll be in Dallas, so
Very
I haven't
cool.
found the dress yet. It's
Well, I have some tips. I'm happy to help you offline.
yeah, it's like this will be I'm an empty nester like you, so this is our
Mhm.
first wedding. We have 3 adult kids, and so it's just really exciting to be in that new chapter of life, isn't it?
I love it. It's wonderful.
Yeah. Yeah. Well, thanks for sharing that. And you're the chief operating officer of this organization. And well, let's just jump in. So, because I want to learn all this stuff. So, people, I went to this so I was just blown away during one of the sessions when Hilary presented. The title of the session was "Speak Out" in all caps. It's proprietary. It's their therapy, and it's a telehealth solution for speech and swallowing in Parkinson's. Coincidentally, the conference was during Parkinson's Awareness Month, so it was pretty cool how they kind of touched on that in multiple ways. We already did that podcast about movement. So
Yes.
today we are going to focus on the speech because we know that people suffer from swallowing and speech issues. And Hilary's going to teach you about that. So I was blown away. And so I reached out to her to ask if she would be a guest on this podcast and we could learn about speech pathology, speech therapist, or however you frame it. But you're going to know today. So here we go. Everyone's ready.
Yay. Thank
All
you.
right. Well, let's jump in. So tell us about um, the Parkinson Voice Project, and I'll have a link to the video in the show notes. But tell us
Perfect.
like how it started, the
Sure.
organization, and
Sure.
keep going.
Yes.
Yeah.
Our founder and CEO, Samantha Ellen Derry, started this organization 20 years ago. And since 2008, we have been using the pay it forward model. So, what that means is no one is paying for their speech therapy, there is no charge for it. Instead, grateful patients who have completed speak out therapy who are so pleased with the improvements in their voice make donations so that the next person is able to receive this very valuable speak out therapy. So it's amazing because in healthcare, therapy might stop because insurance might stop it. So we know that people with Parkinson's need speech therapy for their lifetime, and they also need physical therapy. And probably some OT as well. So they don't have to worry about speech therapy if we are helping them.
That is fantastic. So did you hear that? Another wonderful person working around the systemic challenges and limitations we have. And, everyone here knows that I work in hospice care and, we deal with the end of life. But again, you need to know all the resources available for you when you have a diagnosis so that you can, take action and support yourself. And maybe you're listening to this and you have a family member dealing with this. So anyway, let's just keep learning. So tell us, how does one, just give us the Parkinson stuff, because I know we're in the context of that. And I actually put this in that other Parkinson's podcast about movement, about
Yes.
the stats about speech. Could you tell us about that?
Of course. So what we know is that 90% of people with Parkinson's will suffer from speech and swallowing problems, yet only 3 to 4% receive the vital speech therapy they need. So unfortunately, people are still thinking that someone with Parkinson's should spend the last 5 years of their life suffering without a voice and on a feeding tube. And what we can show is when people stay active with speak out therapy and they practice every day, their voice is not going away and their swallowing is not problematic. They're able to eat what they want and to say what they want. And that is our mission, is to help everyone with Parkinson's regain and retain their speech and swallowing for a lifetime. In fact, our tagline is, we're in it with you for the long haul, because it's not hard to help someone regain their voice. We can show them how to speak with intent pretty easily, but it's that maintenance part. And we know that is the critical part, because Parkinson's is that neurodegenerative disease. Y'all had talked about that, I know, with Nina. And so you have to fight against it. And by understanding that, that's how you can live well with Parkinson's. So speak out therapy helps them strengthen their muscles, and speech and swallowing muscles are the same. So when you're working on one, you're working on the other as well. That's the wonderful adjacent part of how speech therapy helps swallowing. And then we teach them how to speak with intent. Would you like to know more about that part?
Yeah, come on.
Yeah. So when someone has Parkinson's, I should say, when they're diagnosed with Parkinson's, they have typically lost between 60 and 80% of the dopamine. So why does that matter? Dopamine, if you think back to 7th grade biology, dopamine is that neurotransmitter, and it is responsible for the planning and execution of automatic movement. So things we do without thinking about them, like walking down the street, swinging our arms, eating, drinking, managing our own saliva, which is not fun to talk about, but that happens automatically. Putting on that seat belt, getting dressed. All of those things happen automatically. But when you don't have enough dopamine, they get more challenging. And so we as humans are wonderfully made. We have 2 operating systems in our brain. The first one is what I've been describing. We call it the automatic motor system, and it's heavily dependent upon dopamine. But here's the good news part. This is where we offer hope, is that there's an intentional motor system, and it is less dependent on dopamine. So people with Parkinson's learn how to compensate by speaking with intent. And intent just means being deliberate, being focused, paying attention. And what happens is we teach them how to change speech from an automatic function to an intentional act. It's simple, but it takes effort. This actually, before I jumped on here, I was doing 2 evaluations. And one patient, when I asked her, because I can have them speak with intent, I tell them, say that again with more effort. Say it like you mean it, and they will. And I asked her how it felt after she had to do a couple of those sentences. And she said, it felt weird. It felt like I was loud. I said, perfect. So what makes treating people with Parkinson's challenging is that lack of dopamine also makes people with Parkinson's not hear how they sound. So their sensory perception is askew, and their self-perception of speech is not accurate. So when I tell you, I have done so many evaluations, when the patient says, I don't have a problem, it's his hearing, because they literally are not hearing how they sound. And so it makes treatment sometimes getting it challenging. So if they can understand that concept, it helps really quickly. But it's weird, right? I mean, that's not common that people understand that. And so, but that's why I always stress that early intervention is essential, because we want to help them get that habit established of daily practice. With when someone has graduated from Speak Out therapy, and our therapy is not intensive, it's twice a week for 4 weeks, half an hour sessions. And then we have them practice every day for the rest of their life. People with Parkinson's don't need intensive therapy, but they do need intensive practice.
Wow, that's fantastic and exciting. And I remember when we were preparing, you told me that it's never too early and never too late to start.
That's correct. You know, the Parkinson plus disorders, think PSP, MSA, those other diagnoses that oftentimes progress faster, and people might struggle with their speech sooner. And so those, even when someone is at the single word ability, they can only say yes or no. And some families think, it's hard for her to even speak, I'm just going to have her do thumbs up or thumbs down. We always stress, no, have them speak, because that speaking is exercising the swallowing muscles as well. So even towards the end, late stage, it is helpful to keep speaking with intent.
Mm-hmm. Thank you for that. And
Yeah.
then again, we all know that it's a neurodegenerative disease. Again, I see people in hospice, they've come, maybe they have a feeding tube, they have the suprapubic catheter. You were telling me that people can keep those muscles working. And unfortunately, there's a number of people that are dying of aspiration pneumonia because they don't know about this. They're not doing it. Tell us
Yes.
about that.
Yes. So still, the number one cause of death of someone with Parkinson's is aspiration pneumonia. In fact, 70% of people, this is how they die. And it makes me so sad, because speech therapy can help that swallowing to prevent aspiration pneumonia. So that's going to happen when food or liquid is going down the wrong way. And we think about swallowing, never, except if you don't have Parkinson's. The best analogy I can always give is that, have you ever had strep throat as a grown-up and you had a hard time swallowing because it hurt so much? Then you were really aware of swallowing. Otherwise, you don't even think about it. So swallowing is very complicated. And so much of it happens automatically. So that's why people with Parkinson's have to pay attention. They have to think about chewing with intent, swallowing with intent, and behaviorally, those strategies can help them. And do you know how many people eat in front of the TV? I should do research on this. It's a lot. I ask it a lot, because then if you're watching a show and eating, you're not paying attention. So I encourage folks to go back to the table, to take small bites, to chew every bite with intent, and combine with Speak Out therapy. That helps a lot of folks. Now, some may still develop a problem pharyngally, we say, so back, and they may still need a modified barium swallow to assess their swallowing function, and then they may still benefit from swallowing therapy. And so that is an option for sure, but we hope to help them not have to have that, by getting those muscles stronger and practicing every day. And for many patients early on, when they say, yeah, I was kind of having problems, with pills, but after speak out therapy, I am not having problems. Or interestingly, if you watch our testimonials, George is there. George has been in the program for a long time.
Okay.
And he explains that if he misses 3 days of speak out therapy, so let's say he falls off the wagon and he's not practicing, he can tell in his swallowing at that point. So for him, it's like, oh, I have to get back and keep practicing and do it thoroughly, is what he said.
Whoa. Well, I'm going to put George's name in here. Thank you, George, for being the poster kid here. And I'm going to make sure I put his video in the show notes.
Awesome.
So,
He's amazing. Yeah.
wow. So tell us, I learned about, the American Speech, Language, and Hearing Association, ASHA. That's the professional organization for y'all. It's
Correct.
a master's level degree.
Yes.
Let's see. Let me see if I did all my homework right. And this seems like something specialized. So how can someone add this to their toolbox as a speech therapist? How can they do that?
That's a wonderful question. Well, we are urgently trying to train as many SLPs, speech language pathologists, to become certified speak out providers to meet this growing demand. We know there are over 1 million people in this country with Parkinson's, and unfortunately, it's just growing and growing. So we have a 13-hour course. It is fabulous. Most CEUs are often boring. Ours is not. It's a 13-hour course, and there's examples of individual therapy and group therapy, lots of strategies and pointers, and we offer it without charge. We didn't want any barrier out there for SLPs getting trained. We know that hospitals and rehab facilities often are not paying for their continuing education now. So if they treat any people with Parkinson's, they desperately need to become a certified speak out provider. So our course is on the pay it forward model. And what that means is after they have completed it, they have the opportunity to make a donation that will help the next SLP get trained. And we also have a wealth of information on our website for patients and SLPs alike. SLPs are busy. They do not have time to make materials. We have booklets in 13 languages on our e-library that anyone can access, and it goes through the speak out therapy exercises. We also have sets and sets and sets, like 13 actually, of flashcards that we have developed that they can use for any patient they want to, someone with Parkinson's or someone who's had a stroke. We have all of these resources there because they don't have access to them. And it's a great way for them to extend their therapy, make it more effective and meaningful.
Mm-hmm. So this is something, they can go on the website. A family caregiver could buy the book and start working with their person.
Well, yes, or they don't have to buy it. They can get it on the e-library. It's just there. Anyone who goes on the website, it actually is the color of your border. We have a purple e-library button. Yes, I love purple too. On the top right corner, anyone can click on that and have access to all of our materials without charge.
Fantastic.
And I'm so happy you brought up caregivers. Can I expand from that?
You can do what you want. Yes.
So what we know is that Parkinson's is not made to be done alone. And so we intentionally include care partners, their person. Often it's a spouse, or it could be a grown child or a dear neighbor, but someone probably is going with them to their appointments at the neurologist. So we intentionally include that person in the speak out evaluation. And it's critical to their success because we only have them half an hour twice a week for a couple of weeks, but that other person is with them a lot more. So we train them how to cue them, how to speak with intent. And we cue them therapeutically because what's been happening is "Oh, honey, I didn't hear you. What did you say? Say that again." And
Yeah.
the person with Parkinson's is going to say, "Forget it. It wasn't important," which is the worst thing I can hear as a speech language pathologist. Everything they have to say is important. So by training them how to cue them therapeutically, they get better so much faster. And then this Parkinson's journey is complicated. There are so many different symptoms. I heard someone say recently, this is not uncommon to say, "Oh, Parkinson's is a snowflake disease," meaning everyone looks a little different. You think you have Parkinson's, but you're different. But he added, "But we're all in the same snowstorm together." I love that. And so I say that because the care partner's journey is challenging. You think you have it handled, and then meds change or symptoms change. And so there's a lot to it. So we also have a virtual Parkinson's family education group that meets online every month. It's open to the public. We would love to have others join. And we started dropping recordings of past shows there too, to help them on their journey, to give them more education so that they are feeling more empowered and more confident, so they can approach this journey with intent and not be afraid.
That's wonderful. Well, this is the valuable resource, people. So I will have a link to the website, parkinsonvoiceproject.org. And I'm sure you can access all the social media from there. Do you all have a YouTube channel?
We do. Okay. And in fact, our Speak Out Home Practice sessions are there. So if I could back up, when you asked me how we started, I feel like I have to explain COVID. I know it's a bad word, but I choose to find silver linings. And for us, we are, you asked me where we are. We're just outside of Dallas in the clinic here. And before COVID, we were treating anyone who could get here. And so COVID changed everything for us with teletherapy. And that's what I had talked about at the conference, Dr. G, is that teletherapy changed everything. And we could now treat everyone in the state of Texas. Our SLP licensure laws dictates that we can treat in Texas. So that's what we're working on here at this clinic. We are a living, breathing clinic, and we treat patients all the time. We currently have about 530 we are treating, and almost all of those are online because people with Parkinson's are busy. So it makes it so much easier for them to pop in for a session and then get on with their day. So that's great for Texas, but we contemplated, what about the rest of the country? And we are passionate about everyone in the world getting access to Speak Out therapy. So in 2022, we launched our campaign to reach America. And our vision was that we would have a Speak Out therapy and research center embedded in a university clinic that trains SLPs in every state in the country. And from that university clinic, SLPs and grad student SLPs would treat people with Parkinson's in their state online without charge. So it would replicate what we are doing here. They would also do research with speech and swallowing and Parkinson's. And so today there are 32 Speak Out therapy and research centers in the country. So people can, if you're in one of those states, that's on the website. California is one of them.
Yay!
Exactly. There is a center there. You have access to it. You would just call them and schedule an evaluation. And all of the services are provided without charge.
Thank you. Thank you. We did it. I think you covered everything. So
Yay,
people, we know there's 32 states. So speech therapists in the other 28 states. No, I'm not doing math right. 18 states. Sorry.
Come
it's
on.
Time for lunch. My blood sugar is low. 18 states you need to fill that in, get that done so you could take care of your whole state. And
Yes.
Californians, I love California. We're covered already. And so we're going to spread the word and do whatever we can to make sure people know about this. So thank you for being here. Thank you for your work. Kudos to the founder of this organization. If they're still here with us, I don't
She
know.
is. She's right in the office next door. She's amazing. She is
Hi.
a wonderful, amazing, conscientious woman who had this vision, and it's been realized because of her persistence. She's amazing.
Well, thank you very much. And I will do what I can to amplify this. So thank you for being here. It was so great to meet you and learn from you and get this created. So we'll sign out. Dr. G at the Heart of Healthcare. Peace.
Thanks, Dr. G.
You're
Bye-bye.
welcome.